हेलो दोस्तों। तो आज हम एनाटॉमी में डिसेक्शन टॉपिक को डिस्कस करेंगे। द टर्म डिसेक्शन इज अ लैटिन इक्विवेलेंट टू द इक्विवेलेंट ऑफ द ग्रीक टर्म एनाटॉमी मीनिंग टू cut up. Dissection means to cut a part and see. Dissection means to separate and clean the structure. To provide opportunity for medical student to learn dissection technique. Review gross anatomy, three-dimensional structure of the body. dissection, dissection technique: blunt dissection, sharp dissection, dissection for cleaning structure, to clean muscle, to clean nerve, to clean vessels. Underwater dissection technique: these are the technique used for dissections. First of all, blunt dissection. Blunt dissection means pulling, tearing instead of cutting. This can be done by finger, probe, and scissor. Fingers are the first and best dissecting instrument. The next instrument is probe, and next scissor with its back edge. Vessels and nerves can be separated by scissors. Scissors technique: a close pair of scissors is inserted into connective tissue or in between two structures, and then it is opened. During this process, it tears the connective tissue in between two structures and it clean the two surface structures. Second, sharp dissection. It is done by scalpel and scissor. To cut the skin and reflect the flap, the scalpel is used. Otherwise, scalpels are not used because it may cut the wanted and important structure. Dissection for cleaning the structure. To clean the muscle, the surface of muscle is covered by fat and connective tissue. It can be cleaned with scissor. Scalpel can be used carefully. The border of muscle is cleaned by finger or probe. To clean the nerve are cleared by removing connective tissue around the nerve with the help of probe and scissor. Don't use scalpel to clean the nerve because it may cut the branches of nerves. To clean the vessels, vessels are covered by fat and connective tissue. The connective tissue is tear or stripped or removed with probe, scissor, and forceps. Don't use scalpel to clean the vessel because it may cut the branches of vessels. Underwater dissection technique: maze of fat and connective tissue can be discarded out and removed by unwanted dissection technique. In this method, the dissection part specimen is submerged in water and it is trimmed out in the some condition, that is in the water. The this technique is used to prepare museum specimen and to prepare specimen for plastination. Instrument required for dissection: first, skin marking pencil. It is used for surface marking and structure and to mark the bony and other landmark of cadaver. It is also used for marking skin incision. Fingers. First dissection tool is and must be finger. Always dissect first with finger and a finger, then probe, and then scissor. Blunt dissection. Dissecting probe, primary dissecting instrument, used for treating connective tissue. Used for tearing connective tissue. Can also be used for feeling the structure like vessels and nerve. Scalpel, used to cut and reflect skin, used to cut the tissue and dissection of tough connective tissue, used to divide vessels, pedicel, and other structure, used for sharp dissection. Disadvantages: may cut or injure important structure during dissection. Scalpel. Description: two parts. Scalpel has two parts: handle and blade. Type: scalpel with fixed handle and blade. Handle and blade are separated. Normally, separated handle and blade are used. Surgical blade: use hashtag 10 or hashtag 11. Use hashtag 3 blades handle. Advantage of scalpel with fixed handle and blade: it is handle in one piece and it is strong, it is reusable. Disadvantages of scalpel with fixed handle and blade: sharpness of blade required frequent sharpening. Advantages of scalpel with disposable blade. Various size, shape, and curvature of blade are available and used according to the need. Disadvantages of scalpel with disposable blade. The blades are use and throw. Once sharpness is gone, we have to use a new blade. Handle has a slot for the fixing of blade. So slot of handle and surgical blade must be matching with matching one, otherwise no use. Instrument required for dissection. The next instrument is dissecting forceps. The shaft of dissecting forcing is closed by thumb and finger, so it is known as thumb forceps. Dissecting forceps used for blunt dissection, that is pulling or tearing instead of cutting, used to grasp, left and hold the tissue. Plain forceps is used to hold the delicate structure like peritoneum, vessels, nerves, and muscle. Tooth forceps is used for better grip. Tooth forceps is used to insert and blade over handle and to remove blade from the handle. Dissecting forceps, thumb forceps. Description: it has two shafts and no joints. So two shafts, that is blade, are joined at the top end and they have spring action. Objects are held by tip when the shaft, that is blade, are passed by thumb and fingers to provide firm grip on tissue, and firmness depends upon the pressure on the shaft. The two consecutive movements can be done faster by dissecting forceps. Artery forceps also give firm grip, but the two consecutive movements are slow. The first diagram is wrong and the second diagram is correct. That is correct holding of dissecting forceps. That is thumb forceps. Used for grasping and holding tissue, muscle, or skin surround a wound. Single toothed on one side fits between two teeth on the other side. Dissecting forceps, that is thumb forceps. Type: plain forceps, tooth forceps, tissue forceps. That is tooth forceps is used for gripping the tissue. Is also known as tissue forceps. Description: it has two parts, one blade and one tip. Blade is long. On outer surface there are serration for better grip for handling. Plain forceps is having ridge and grooves, and tooth forceps is having tooth and sockets which prevent the slippage of the tissue. 1 into 2 toothed tissue forceps used for grasping and holding tissue, muscle, or skin surrounding a wound. Single toothed on one side fits between two teeth on the other side. Plain thumb forceps used to hold tissue in place when applying structure, used to gently move tissue out of the way during exploratory surgery, used to their packing into or remove objects from deep cavities. Scissor use: it is used in cutting and sectioning of tissue. It is used to cut tough structure like tendon, ligament, etc. For blunt dissection, straight scissor is used. For delicate work, curved scissor is used. Description: it is having blade and body, that is handle, joined by pivot joint, that is axis is formed by screw. Blade: it has two edges, cutting edge and non cutting edge. Scissor: blade may be plain, curved, or having angle between shaft and blade. According to that, scissor are known as plain scissor, curved scissor, angular scissor. The curved scissor used for the trimming purpose. The angular scissor is used for deeper structure. The tip of the blade may be pointed or blunt. Pointed scissor may be used for blunt dissection. Sharp blunt scissor. Mayo scissor used to cut and dissect fascia and muscle. one blunt tip and one sharp tip. Curved blunt, that is blunt scissor. Metzgenbium scissor, both blades tips are blunt, can be curved or straight. Hemostatic forceps, that is artery forceps. Normally it is also known as artery forceps. Hemostatic forces are used on artery, vein and capillaries. It is used for strong grasping and holding and catching. Disadvantages: to crushes the delicate structure. When it is used as a holding forceps, two consecutive holdings of structure is slow, but in dissecting forceps, two consecutive movements are fast. Homeostatic forces, that is artery forceps, is a description. Homeostatic forces is designed specially to catch, clamp, and to crush the tissue parts. Shaft of body, shank. It lies between joint and finger bow. Finger bow, that is ring. It is used for holding the instruments. Catch, rigid. It lies between shaft and finger bow. When the catch rigid are pressed, the blades are kept in close position. That is, three catches are for: first catch for catching the tissue, second catch for clamping the tissue, third catch for crushing the tissue. Curd, mosquito hemostat, used to hold delicate tissue, used to compress bleeding vessels. Jaws are fully serrated. Kelly hemostat, used to clamp small vessels or hold tissue. Jaws are partially straight, curved or straight. Needle holder, it is used to hold the needle parts. Shaft of the body, that is shank. It lies between joints and finger bows. It is used for holding the instrument. Used to hold and pass a suturing needle through tissue. Has groove to hold needle within jaws. Catch retreat, it lies between shaft and finger bow. When the catch retreat are passed, the blades are kept in close position. Different between hemostatic forceps and needle holder. Hemostatic forces, it is light instrument. The needle holder is heavier instrument. Hemostatic forceps has blade length 1 by 3 and shaft length 2 by 3. That is, shaft length is bigger than blade length. Needle holder has blades are small. In hemostatic forceps, transverse section on the inner side of blades. In needle holder, serration, crisscross or transverse and groove in blade. In hemostatic forceps, jaws screw type or may be box type. In needle holder, joints is box type only. Skin hook, flat end is a blunt retract retractor. Three prong end may be sharp to dull. Used to retract small incision or sears a skin edge for suturing. It is done, that is anatomical dissection.